It is currently 8:16 on this Thursday, July 30th. We love Thursdays because it's the day before Friday. And we also get to talk to Dr. B with People's Health. Dr. Brent Wallis, the Chief Medical Officer of People's Health. peopleshealth.com/radio. It's a one-stop resource for seniors and grown children of seniors to navigate their way through the choppy waters of healthcare. From doctors and medications to Medicare and Part D drug coverage, you can find everything, and I mean everything you need or want to know at peopleshealth.com/radio. And today is a topic I think that applies to everybody, not just elderly or seniors, but the children of seniors as well. If you found out today that you or a family member had a life-threatening illness, would you be prepared to make quick health care decisions? And I'm not a senior, but I'm facing that because I got knee surgery coming up, and I just want to make sure everything's in place. Well, Dr. Brent Wallis from People's Health is here to explain the process of advanced care planning and why it is so important. Morning, Dr. B. How are you?
Hey, Tommy. I'm doing good.
A pleasure to talk to you again, as always. I hope it's been a good week for you and the boxer.
Yeah, definitely. We've been hanging in there, a little wet.
Yeah, well, yeah, that's right. And that's what I told Betsy last night. I said, man, your feet haven't been dry in God knows how long. Tell me about advanced care planning. What does it mean to plan for care in advance?
Sure. It's it's sometimes a difficult discussion that people aren't prepared to have, but advanced care planning is really a way to keep control over your own health and to ensure that you get the care you want. And it's particularly important when a really serious or life-threatening illness might leave you unable to communicate those wishes or desires, those decisions to your healthcare providers and to your family. So what advanced care planning really is where you map out the kind of care that you want in advance before you get sick so that everyone knows exactly how to treat you going forward.
Are you required to do this?
No, absolutely not. There's no requirement, but it really is something important that everyone should do. And like you said at the opening, this is not something just for seniors. It's really everyone. Even when you're in good health, and sometimes even in particular when you're in good health, it's never too early to make those wishes known. And then our state and federal laws actually require healthcare institutions and physicians to respect those wishes once you've declared them in an advanced care plan.
And I think it's the best thing you can do for your family, because if you have multiple children, the last thing in the world you want is a dispute over what happens with you when you've tried to keep the family together your whole life. Right, Doc?
Yeah, and people really should be in control of their own health decisions, and you don't want to put your family in a situation where they have to make decisions without really understanding, what you want and what your wishes are.
We got a lot more coming up. We're going to pick it up here when we come back with it's not just for older people. I mentioned I got a surgery coming up. I'm going to make sure everything's in place just in case so that it's not put on the shoulders of my kid. 8:20, time for traffic now, WWL. Tommy Tucker, WWL, our favorite time of Thursday morning and in a lot of ways of the week. Dr. Brent Wallis is with us, Dr. B, Chief Medical Officer of People's Health, and we're talking about senior health. And Dr. B, we pick it up here where what we're talking about here with advanced directives, that is not something that only people that are seniors need to do.
No, definitely not. And that's a misconception. Like most things in life, it's better to be prepared. And, unfortunately, you could have an unexpected crisis at really any age. And like you mentioned, even going into surgery, you don't always know what the outcome may be. So really anyone of any age should take those steps to kind of make their wishes known long before they really think that they need to. It's the only way to truly be prepared.
And again, just to revisit for a little bit, it is very important in terms of, I guess, during a crisis, that's not really the time to think things through, is it?
Yeah, not at all. You may not have the capacity to do that, and if you don't have advanced directives, then usually that burden falls to your family. And in Louisiana, it's pretty prescriptive that it falls to your spouse. and then from there kind of goes through the family in a very organized way. And so someone in your family may have better knowledge of healthcare. They may have better capacity to make decisions and to carry out your wishes. So you don't want to put that burden on someone who really you don't think can handle it, because you're really catching them in a bad situation and putting them in a situation that they may not be able to handle.
So what are advanced directives?
So it's pretty simple. Advanced directives are really just two documents. They're written documents. The first one is a living will, and the second one is a power of attorney. And a living will really outlines the treatment that you either want or you don't want when you're in a situation like we're talking about. And then the power of attorney specifically designates who, either a family member, it can be a friend, someone who you trust that's going to actually advocate for you and relay those wishes to your healthcare professionals. And so both of those forms are part of your advanced directives, and they guide your doctors and the hospital to do exactly what you want them to do if you're in a situation where you can't tell them.
This all starts with something. How do you get the ball rolling? How do you get the process going?
Yeah, the best way is really to talk to your primary care physician. They're all very well versed in how advanced directive works. But there's also a lot of resources that are available. We have some great ones actually online at our website, peopleshealth.com, advanced care planning. What you want to think about when you have that discussion, because it's a difficult discussion to have, who do you want to make those decisions for you, what types of treatment you want, and specifically what things you don't want done. And then, you need to have a discussion about comfort measures. If you're unfortunately in a situation where things don't look good, you have to decide, do you want to be comfortable or do you want all efforts taken, to try to save you. So you've got to really trust your physician and trust your family to have those discussions with them. And like I said, it's a very difficult discussion to have, but it's one that really everyone must have.
You talk to your doctors, you said that, and your family and your friends. I know we went through it with both my mom and dad when you talk about the comfort measures, because the doctor will tell you, we can help them with the pain, but it's probably going to slow the respiration. And with my dad and mom both, they did not have advanced directives. They were able to tell us what they wanted, but otherwise it would have been a tough place to be in. So to find out more about these advanced directives, Dr. B, and hopefully people will take this under consideration, realize how important it is. It's not pleasant, I guess, but you do want to be in control of what happens to you, and you don't want to dump it on your family. So People's Health, they got a resource that people can go to?
Yeah, we've got lots of information online, like I mentioned, at peopleshealth.com/advanced care planning. There's some really good links on our website to something called the Conversation Project, which actually helps you kind of start that conversation with your family and your doctors. But there's a lot of information on there. After you have the conversation and complete some of this, the other thing you can do is actually reach out to us, and we can keep a copy of your advanced directives on file as well. So if you ever need to access them, you can actually just give us a call.
Thank you, Doc. You can always go to peopleshealth.com/radio. You can call 1-855-821-2666, and you can follow People's Health on Facebook, Twitter, or Instagram. Dr. B, a pleasure as always. We'll talk to you next week.
Thanks, Tommy. Have a great week.